Hello everyone, I am Dr. Prapanna, a practicing hair restoration surgeon at Craft Cosmetics and Hair Implantation in Kormangala, Bangalore. Hair transplantation is an elective procedure. However, regardless of the desire for surgery, patients need to fulfill certain basic criteria for hair transplantation. For example, if you belong to male pattern alopecia or androgenetic alopecia, a hair transplant needs to yield a good satisfactory result. In younger patients who are experiencing hair thinning or hair loss, they need to first opt for medical therapy, which would involve the use of minoxidil or finesteroid, or they can also opt for platelet-rich fibrin treatment for hair thinning. And this treatment actually needs to be continued at least for 1 year. And later on, they need to be reevaluated before considering for a hair transplantation procedure. Third, presence of adequate donor area to fulfill their current and future needs. And fourth, a realistic expectation or outcome from a hair transplantation procedure. Now, most of the young patients think that a single hair transplantation procedure will be sufficient to fulfill their current and future balding needs. They would also request the hair transplantation surgeon to restore their adolescent hairline and their old density. Now, despite all these requests, generally a hair transplantation is not performed for patients who are younger than 24 or 25 years of age for the 5 main following reasons. Firstly, it is very difficult and sometimes impossible for the hair transplantation surgeon to determine the boundaries of the donor area. Now, the donor area is that part of the scalp which contains hair in the sides and back of the head. Now, these are the hair that are used for hair transplant. Secondly, it's again very difficult and impossible for the hair transplantation surgeon to know the stability of the donor area in younger patients. Thirdly, if you are noticing severe hair thinning or hair loss in your early age, we can anticipate the degree of baldness to be really severe even in the coming years. Fourthly, younger patients generally have very high expectation from a hair transplant. Now, an unrealistic expectation can always lead to an unsatisfactory result. And the fifth and foremost, in younger patients, they would generally not know what kind of a hairstyle that they would want in their future years, let's say 5 or 10 years down the line. Because if they opt for follicular unit transplantation procedure, that would leave a linear scar in the donor hair. And also, if you're opting for a follicular unit extraction, it would leave certain tiny dots in your donor area. And this would not allow them to keep short hair at the back. Therefore, the age of the patient, the stability of the donor area, the availability of the donor area, and the pattern of hair loss are very important factors to be considered before opting for a hair transplant.